Having health insurance or buying groceries. Hundreds of thousands of people in North Carolina say they can't afford both and they have to make a choice.
But sometimes they are actually the ones who end up paying higher medical bills. Anchor Allison Lottis has been investigating all this for us and joins us now in the studio.
Hundreds of thousands are stuck in this gap. They make too much to qualify for Medicaid, but not enough to afford insurance. One young man is in that situation now, facing nearly $40,000 in hospital bills. He's just one of many caught in the middle of a fierce fight over health care.
Shattered glass, twisted metal. 23-year-old Xavier Munoz doesn't remember much about being hit last year on I-77 in Statesville.
The impact of the airbag was really hard, so it's just like I couldn't see straight, couldn't think straight, everything was foggy.
Munoz woke up in the hospital with a brain bleed, but his immediate concern wasn't his health. It was the fact that he didn't have health insurance.
First thing that came to my mind was like, how am I going to afford this?
Why didn't you have health insurance?
I couldn't afford it.
The hospital charges $5 per tablet.
Dre Fleury is Munoz's attorney. He told me Wake Forest Baptist Health in Winston-Salem, which is where Munoz was taken, demanded he pay 100% of the bill. There was no negotiated rate like patients with health insurance receive.
You pay your copay or your deductible, and they work it out. But when you're uninsured, and a hospital charges you 100%, we feel that's unfair.
Now, how much do you owe?
As of right now, I owe them $38,777.
Munoz is one of 500,000 people in North Carolina in a health care coverage gap. They don't qualify for Medicaid, but don't make enough to afford insurance.
The fight over making health care more affordable has been front and center here at the state capitol. I questioned Republicans who refuse to expand Medicaid and Democrats who say it must happen.
There is no defense. I can't say anything to that young man as a legislator other than we have done you and the state an enormous disservice.
Democratic State Senator Jeff Jackson wants North Carolina to expand Medicaid like 37 other states have, so more people qualify for it.
We're funding this in other states. Makes no sense.
What happens if Republicans and Democrats can't reach a deal?
A lot of human suffering.
Senate President Pro Tem Republican Phil Berger doesn't believe expanding Medicaid will actually increase access to care.
You argue it could actually hurt the state.
If we expand Medicaid as is being proposed and the federal government changes their policy in terms of how much they're going to pay for Medicaid or the expanded population, then what happens to those hundreds of millions of dollars that we would then have to make up?
Since lawmakers have now adjourned, the political fight over health care is likely on hold until the new year. But in Rowan County,
My eye drifts up sometimes, so then I start to see double vision.
Munoz now lives with long-term effects from his crash and still doesn't have health insurance.
Healthcare should be more accessible to everybody because everyone deserves a fighting chance to live, just in general, and be able to afford it.
Xavier Munoz was not at fault in that crash and did receive some money because of the accident. His attorney argues he should be able to use that money for future medical care, recovery, and even school.
Yeah, I certainly feel for him and so many others out there in the same situation. The question is, do hospitals ever offer a discount to those who don't have insurance?
I checked around. Wake Forest Baptist Health would not comment on this specific case. They said that they do offer discounts to uninsured patients, but they don't consider anyone in a car accident who receives liability coverage to be uninsured. Closer to home, Atrium Health told me they offer a 50% discount to uninsured patients on hospital services deemed medically necessary. Novant provides financial assistance if the household income is at or below 300% of the federal poverty level. For patients who don't qualify, Novant does offer a discount.